Hello, everybody. First of all, I'd like to thank from the bottom of my heart to Carrie for this invitation. Also to Jeff for all the organizing things. Amanda and all my good friends here in the room that already took some courses in the last few months. Canada is a wonderful country. You have a huge potential also for apitherapy. And I'm glad that you do not know so much on apitherapy because it's a lot to learn, and when it's something new, it's more exciting. So, what is apitherapy? Let's start with the definition. It's an integrative, complementary, some people say alternative art and science that uses all main 10 B products. There are in fact about 17 B products which we can use in apitherapy to prevent, heal, or recover a living being. Living being meaning a man, but also an animal or even plants. We can add plants to be happier with bee products from over 800 conditions or diseases. So api comes from the Latin name of the bee, Apis mellifera, apis, api, and therapy comes from the Greek word therapoin. A bit of history. You know, this kind of images you saw in many beekeeping books. The evolution of the mankind was also always related to the bees. For millions of years we have been in contact with the bees, especially because the bees have been for us a source of carbohydrates and proteins. 12,000 years ago, and you can see it today, in Nepal, in Asia, you see this kind of honey hunting done high up in the mountains or sometime in the trees. And from the past to the modern time, you see a few images about the use of honey intravenous here, honey as eye drops against eye diseases, bee stings through a special mesh that allows that the bees can sting several times but does not lose the stinger. And there are some other alternatives here too. Honey in a hospital in France used against the wounds, and honey and propolis against the wounds too. So these are just a few glimpses into the realm of apitherapy. What are the main products we can use in apitherapy? So I mentioned to you only some of them. Here is, do you know what is this? Bee bread, very good. So this is bee bread. Bee pollen, the best bee pollen for apitherapy is the fresh pollen, not the dried pollen. Dried pollen is good for the general population, for healthy people, but if you want to heal somebody faster, you need fresh pollen or fresh frozen pollen or raw pollen. Then you have bee venom, of course, you know. Honey in the honeycomb is the best for apitherapy because the bees are cleverer than us in the sense that they protect their honey against oxidation, against dust, against particles, against spores, and so on and so on. And also, this capping of the honey is useful because the honey is not losing the aromatic oils, the essential oils. And you may have heard about aromatherapy. Aromatherapy is a healing method which uses the aromatic oils or essential oils. And these aromatic oils are very powerful antibacterial, antiviral substances. So when we do the centrifugation, it's very good because we get a fluid honey, which is good for the general public. But we can educate the general public and tell them also that honey which is in honeycomb form, even if it's crystallized, is healthier than centrifugated honey. Then we have the propolis, and then here it's like a recent discovery about, let's say, 50 years. But in 1987 in Austria, they made first time a device to extract the beehive air. And you see the method, it's the inhalation of the beehive air. So you have here the beehive, some filters, and you can inhale the beehive. It's the same principle, beehive air. It's the same principle like in aromatherapy. We use the perfumes of the plants, in this case of the bee products, to heal lung diseases. Then we have the beeswax, which you know already. We have here the apilarnil, the drone larvae, which are used a lot in Romania and several other countries in the last years for many properties. And here you recognize this part. What do you have here? A queen cell. Yes, so this is for royal jelly. For royal jelly protected in the honey and also in the jar and also in the same queen cell. It's the same principle like for honey. We should not take out the protection unless we use it immediately. Same is for royal jelly. So ideally is to get fresh royal jelly, and many beekeepers in Europe, in other countries, they know about the properties of royal jelly. So when they find a queen cell in the, and you found for sure as beekeepers, when you take fresh, very fresh royal jelly from your own colony, the power of this royal jelly is very strong. It's much stronger than the classical royal jelly. So it's a good idea to have it protected like this, like we have protection here. And the bee bread, which is the fermented pollen, which is also very healthy for many diseases. How many apitherapists are in the world? Just an idea. But let's look first how many beekeepers are in the world. I looked in several countries on statistics, and roughly there is one beekeeper for 1,000 citizens. 1 to 1,000. So the poor beekeeper must make so much honey for 1,000 other people. So it's a lot of work to do. And from this 1,000 beekeepers, if we take, it's about one apitherapist. So, but still it's good. We are good because the world is big. We have 7 billion people on our planet. So we have at least 7,000 apitherapists all over the world. Most of them are in Asia. You can see here one photo done to one of the Apimedica symposiums in China. And you may recognize where I am in the photo. You saw me? I am here. Okay, China, Asia, Taiwan, Malaysia recently, Japan, Korea are very good in apitherapy, and they are doing mainly bee stings therapy and a special form of bee stings therapy, micro bee stings therapy, which is less painful than a mosquito bite. It's a special technique. Okay, some achievements of apitherapy. Wound treatments with honey and other bee products, success rate is over 90%. I repeat, 90% in the wounds, even in chronic wounds, infected wounds, and so on. The 10% are for the people which are really very bad, very old, many complications. But normal people which have still reserves, metabolic reserves, energy reserves, they can get healing. Gastroduodenal ulcers, success rate is over 80%. Otorhinolaryngological diseases, ear, nose, and throat diseases, over 80% success. Like sinusitis, rhinitis, hay fever, laryngitis, pharyngitis, and so on. These are very easy to cure because these organs or tissues, if you prefer, are very nearby. So you can use the bee products directly. So you have direct contact. So you can get faster results than if the tissue or organ is far away in the body. Also, we know in the literature, if you look, there are over 800 diseases which can be treated with apitherapy. A short look at various elements of apitherapy. Honey as a healer. Here is one slide which kind of make a synthesis on the evolution of the wounds when you treat with honey. Honey is antibacterial. Honey has a lot of different categories of substances which are helping the cells to be happy, to work properly. So when you give in these situations honey first will clean the wound of bacteria, will clean the dead cells, because honey, you know, is hygroscopical. It absorbs the water and it helps the cleansing. And then in the same time, honey is giving into the tissue good substances. And even if honey it's are only 3-5% other substances than glucose and fructose, these other substances, minerals, enzymes, vitamins, and so on, they are very useful for the healing because the cells can take directly. Anyway, when we eat directly a food, this food is diluted all over our body, and finally at the cellular level, like here, the amount of what we ate is extremely small. And same is this amount of substances in our honey. The advantage is that we use honey locally, topically, so we use it directly on the cells. So it's like we have eaten the same substances, okay? Okay, so then honey cicatrizing and so on and so on. So there are many things to speak about the wound healing with honey, but let's go faster. Propolis as a healer. Propolis is wonderful for the treatment also of the wounds. Here we have some examples. One beekeeper lady from Germany, she got this kind of wounds. She fell down and she got 3 wounds here with hemorrhage. And this was in front of the airport of Dublin in Ireland before the Epimondia Congress. So we washed with just water, simple water, the wound. Then we applied propolis. Propolis tincture was this first day. Then we wanted to go to the hospital, but the lady refused because she said, I'm fine. In 10 minutes, 15 minutes, she was having not any more bleeding, no more pain. She was okay, and she went with us on the city tour and so on and so on. And the third day, this is a photo made on third day, propolis cream. She used propolis cream afterwards. And in 13 days, less than 2 weeks, she was cured completely. The lady was like 73 years old. So this is just one example. But propolis is also used as aromatic, as a propolizer of the air. And it's very famous in Italy and now in Germany, Europe, Romania. There are many countries which are importing this kind of product. And luckily, Canada has also a representative of this company. So there are several devices like this. Here you have the propolis. They put a special propolis extract in a special tube. And here inside, it's an electrical system which heats the air from inside. So it's same principle like in aromatherapy. You have some heat below, and then the volatile substances are going into the air. And there are several options. You see here the propolis in this capsule. And there is another very good option for the cars. In our cars, you know, we have a lot of pollutants, and it's like 10 times more pollutants and microbes in the car than outside the car, even on the highways, because of the plastics and so on. So it's a very good idea to clean the air in the car with propolis. And this is another system. And now, for a couple of years, they came with the idea to add masks, so with this tube, so you can breathe directly from the device. So this is mainly for patients having more problems with the lungs, bronchitis, asthma, and so on. Propolis is also very, very good against teeth disorders, teeth problems, to prevent or even to treat some of them, like gum diseases, bleeding, periodontitis, when the teeth become loose and you may lose them. Then it's a good idea to take propolis in liquid form, not to chew it, because if you chew it and the tooth is losing, you'll lose it. Okay, so but liquid propolis in some honey is very good to treat this kind of diseases. And there are tons of articles about the anti-inflammatory, antibacterial properties of propolis and so on. And about the antibacterial property of propolis, like with honey too, you may memorize this idea. Propolis is an intelligent antibiotic. Is an intelligent antibiotic. Why? Because the classical antibiotics, the chemistry-based antibiotics from the pharma industry, they are dumb antibiotics. When you take them, it destroys everything which is in your system, including the good bacteria. And the good bacteria is responsible for many, many things on the immune system and so on, vitamins production. So when you destroy all these good bacteria, you create practically a disaster in your body. So propolis, honey, royal jelly and so on, they kill only the bad bacteria. It's like the good soldiers from a good army. They can see in a room that is a terrorist. So they shoot only that person, not the other ones. So this is great because in the last years, whole world is facing a huge problem with the resistance to antibiotics bacteria. There are literally thousands of people dying every year in every country. They go into the hospital more or less ill, a bit ill or healthy at the limit, but not severe diseases. And then they get in the hospitals very bad bacteria, which cannot be destroyed by the antibiotics. So the last resource for us, for epitherapies, for beekeepers, is very good because honey, propolis destroy this bacteria with no doubt. If they are used properly, high amount concentration, they can destroy this bacteria. Bee venom as a healer, you know, bee venom, bee stings, pain, and so on. but bee venom is a big healer because it's a very powerful stimulator of the nervous system. And you know that our body is run, it's controlled, is coordinated by the nervous system. And if you have a strong nervous system, then you have a faster healing. But there are other uses too, like bee venom in a cream form can be used against this kind of tumors of the skin. It's Verruca seborrheica, it's the medical name. It's practically warts, yeah, caused by fat. Yes. Thank you very much. Thank you. So when you apply bee venom here, it improves so much the blood flow, local blood flow. Bee venom is also antibacterial, antiviral, and so on. But there is another property. Inside goes inside, and it stimulates also the stem cells on the skin, and it helps the regeneration of a new skin, healthy skin, because the stem cells have the memory of the useness, memory of correct cells, correct functioning. Okay, bee venom used on acupuncture points. There is a whole method, science, if you want. In Asia, I told you, we named it apipuncture. And the beekeepers, when they have problems in the joints, usually they sting on the joint where they have the pain, which is pretty good. But if they know a bit the acupuncture points, these trigger points, they are known in neurology. These trigger points are more active. So when you stimulate these points, the healing comes faster. And another property of bee venom, there are over 40 properties of bee venom. One of them is lytical. It's like destroys the scars. The scars are made by hyaluronic acid. And in bee venom, we find a substance, an enzyme, which is named hyaluronidase. And this enzyme cuts the hyaluronic acid. So you can get rid of scars in a nice manner, very cheap manner. Plastic surgery would cost maybe 3,000, 5,000 Canadian dollars. But with this one, it's much cheaper. The only thing is that it's longer in time. So like you need a couple of months to get rid of a scar. Another spectacular treatment with bee venom is arteritis obliterans. When people are smoking too much, they get a problem in their arteries. Like the heart attack is caused by blood clots. When these blood clots are blocking the arteries of the feet, then the people get a gangrene. Gangrene, it's like a necrotic tissue. And you can prevent this situation with bee venom, because if you do bee stings on a certain path, certain way, you can create new blood vessels. And this finding was done by Dr. Alexandru Parteniu, the pioneer of bee venom therapy in Romania. And he found that this neocapillarogenesis, this is the scientific name if you want, but basically bee venom creates a bypass around the blocked artery. Infertility, it's another use of bee venom. The main cause of infertility is lack of blood flow in this area of the body, not only in women but also in men. And bee venom is a very powerful stimulator of the blood flow, and it's a stimulator of the nerves in that area. Because there are women or men, they make physiotherapy, massages, and so on and so on. And this may help temporarily, but if you do not stimulate the nerves will not be able to coordinate afterwards the blood flow in that area. So this is the big secret in apitherapy with bee venom. This again, the arteritis obliterans, ulcers, treated with bee venom and honey in Italy by Professor Ferraboli, Franco Ferraboli. Okay, there are many such photos. Multiple sclerosis, it's known kind of treatment with bee venom therapy together with royal jelly, large amounts of royal jelly, over 8 grams a day of royal jelly. And there are many mechanisms of action here, but basically what you can get, you can get a stabilization. The disease does not evolve towards worsening. And some people, like 80% of them, they can get improvements in their symptoms, like more energy, more stamina, more strength, better coordination, and so on. And about 10-15% they may even get call them cured people, because they have completely normal life, even if they continue to have the lesions in the brain. And this you can explain through another phenomenon, which is bee venom stimulates the synapses, the interconnections of the nerves into the nervous system. And even if you have like 10, 20, 30% of the nerves destroyed, if the other neurons are working better, they can supply the same function. It's like in a football team, soccer or American football, when the referee sends out some bad players from a team, but the rest of the people in the field, they can work and play harder and can even win the match against the other team, which is a normal number of players. So it's known in medicine, this kind of function. Pollen royal jelly and other hive products, type 2 diabetes. This is, it may be for you surprising, but it's very easy to improve or even to cure type 2 diabetes with a good diet, exercise, and a lot of propolis and royal jelly. And there are tons of research on this, propolis, royal jelly, how it works for pancreas, for the cells, for membranes, and so on. And you need also herbs, medicinal herbs for this. But believe me, it's not a problem type 2 diabetes. Type 1 diabetes, yes, it's a problem because it's mainly genetically induced. It's a long disease, it's a chronic disease. So it's very difficult to treat this one, but type 2, it's easy to treat. Obesity, you have here plus McDonald's, Monsanto, KFC, and so on. So this is the evolution of the North Americans. I'm happy that the beekeepers in Canada are not belonging to this category because they use bee stings, propolis, bee pollen. And there are many mechanisms of action here when you can use bee venom activates the blood flow and the metabolism, the catabolism, and so on. But I'll not go in details. Premature aging. The most dangerous thing which attacks the chromosomes and attacks this part of the chromosome, which the ends, they are named telomeres. They are in a way responsible for the longevity, for our length of our life. So they are attacked by free radicals, by many, many factors. And the stress altogether is the worst factor against this problem. But there is the possibility to slow the aging. Really, biologically, you can slow the aging. Even you can, for a short period of time, you can go back in time biologically, not chronologically. And many people which are taking pollen, for example, they have this euphorizing effect, happiness effect. Like after a few hours after you take fresh, good pollen, you feel like younger. And I can give you the explanations, but I have no time to do it. Honey also gives this energy feeling very clear. Bee venom, there are studies who show that bee venom improves the blood flow all over the body. And the people which are dying earlier than normal, they have usually cold hands, cold feet, cold body. So coldness is a bad thing for the health, but bee venom improves the heat in the body. Royal jelly is known for many, many years for its properties to prolong the life, not only the queen. We know the queens, they live 40, 60 times longer than the worker bees. You know the theory. But also when they did the studies in mice, in different other animals, they saw that it prolongs to the maximum possible life length of that species. Propolis also is good to correct the genetical errors, small genetical errors. This is known as epigenetics, or nutrigenomics. Now it's like the food can influence your chromosomes. Many years ago, it was believed that the food cannot change your genes, but it's not true. They found out, the Japanese, that the Japanese, they eat a lot of algae, sea algae. And they found in the genes of the Japanese genes from the algae, from the ocean. So these small substances can penetrate so deeply, including in the chromosomes. So when we eat enough propolis or honey, we can have same kind of effect. And I'm happy to tell you that a couple of years ago I was in Malaysia and I was giving some lectures on apitherapy, and one of the students was a genetician, and I told them that beekeepers live longer than the rest of the population. It was a study done in Germany on this. It proved that in medium, statistically, 3 years longer than the rest of the population. And I told him that for sure the beekeepers have longer telomeres. I showed you before the telomeres are longer than the rest of the population. And luckily this guy got funds from his university, and he made a study, scientific study on 30 Malaysian beekeepers, and he found out that these beekeepers was having the telomeres longer than the rest of the population. So, which is fantastic proof, scientific proof that the beekeepers are stronger than the rest of the population. But what was fascinating, I was expecting this kind of result, but what was surprising and in a positive way was that among these 30 beekeepers, the ones who were taking more honey were having even longer telomeres than the other ones. So you can reverse the aging. As I told you, you can, the telomeres, it was a theory before, you cannot regrow them. They go like, they said that they are cut step by step and you cannot regrow them. But they show that other studies that you can regrow. So basically, theoretically, you can do the slow aging, reverse of aging. And here is one beekeeper lady from Indonesia. She started with bees in 2011, and you see in 5 years the result. Contraindications and limitations of apitherapy. Of course, the main contraindication is the allergy. Each bee product can give an allergy, and very, very seldom we find allergy in honey. Very, very seldom, because honey has very few substances which are, powerful. But in propolis we find, especially on contact dermatitis, the beekeepers which are in contact with propolis, they get more often propolis allergies. In beehive air, it's not known this kind of reaction, but it may come in the future. Beeswax also is extremely seldom. Some cases were on royal jelly. Bee bread, I don't know, and one of the reasons is that the acids from lactobacillus, the acids are cutting the proteins, and the proteins are usually allergens. And of course there are allergies also on bee pollen and on bee venom. But the good thing is that the allergies, the doctors specialized in allergies, they can treat all these allergies. There are protocols to desensitize, there are ways to do it. And of course you have ways to prevent these allergies. And tomorrow we'll have a course on apitherapy, one-day-long course here nearby in Cottonwood Manor. And I will explain in detail how to prevent and treat these allergies, especially the bee venom allergies. Okay, limitations of apitherapy are caused usually by mistakes in diet and lifestyle. And here is the point. I can give to a patient 30, 40, 60, 100 grams of good beehive products per day, very good ones. But if besides these 100 good beehive products, the person eats 1 kilo of bad food from McDonald's, or cookies, or sugar, or gluten-rich things, or dairy products, and so on, my 100 grams of good products will have a difficult time to fight against these bad ones. So you need to change the diet, you need to improve the diet, and the diet must be individualized. Like each person needs another kind of diet, because each person is different, has another metabolism, other diseases, other conditions. So like in Ayurveda, maybe you know traditional Indian medicine, in Ayurveda they say that each person is different. We say also in homeopathy, even in medicine, but in normal classical medicine has a tendency to put everybody on the same level, like 100 people with gastric ulcer should receive the same treatment, which is a mistake, because you need to individualize the treatment. And then there are many errors of lifestyle. The main problem with lifestyle is the lack of sleep, of good quality sleep. Because all the other ones, stress during the day, smoking, bad behaviors and so on, they may be more or less corrected during the night, if the night is very good, if the sleep is very, very good, because during the night the sleep helps the brain to regenerate the nervous system and so on and so on. How can we get into apitherapy? How do people learn about apitherapy? We have intensive courses. I just told you about this course which we'll have tomorrow in Cottonwood Manor from 9 to 4. But there are several other courses which you can follow. We have in Surrey, in Honeybee Center. I'm the Apitherapy manager of Honeybee Center for some time. And we have in April 8 and 9, we'll do an intensive bee venom therapy course and workshop. And the people will learn how to do for themselves bee stings, micro bee stings, and so on, or to prevent allergies. Also, we have in Vancouver, thankful to Tony, which is here, Tony Loves, we have in Honey Shoppy, in April 12 and 13, one course on apitherapy, 2 evenings. And then online courses, for those of you who cannot travel so easily, you can stay at home, you can connect to the internet, and we have a 100 lessons course. It's a course for about 6, 9, 12 months even, with theses, exams, exercises, PowerPoints, and so on and so on. But this is for the ones who really want to learn very well apitherapy, who wants to go deeper. Then the good, excellent news is that recently it was created the Canadian Apitherapy Association. When I came from Europe, my main mission, my main goal was to help to the creation of this association. And I'm really happy to tell you that it was created recently in Nelson. And you can already write down Canadian-apitherapy-association.org. And you can join this association and of course learn more on apitherapy. Also, if you speak French or if you know some friends or colleagues in the family who are speaking French, you can join the Francophone Apiphytotherapy Association. You can join American Apitherapy Association, apitherapy.org, our colleagues from the South. They are very dynamic. They organize each year one course and workshop, a couple of days to 3 days. And they have a very good network. Hundreds of people are in their network. So many patients are asking, okay, I have multiple sclerosis, where I find an apitherapist? And the advice is to join the American Apitherapy Association to be able to get this network list. German Apitherapy Association, we have friends which are speaking German, and many Germans also in Canada. And Germany is very, very active. It's because the president is Dr. Stefan Stangaciu. No, I'm joking, of course. We are organizing now next week the 14th Apitherapy Congress in Germany with international participation. And each year we find many, many new things. We invite speakers from all over the world. And it's really fascinating. I am in apitherapy in the last 25 years, and you may think that it may be boring. You know, every day honey, 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 propolis, 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 propolis. But it's, believe me, it's fascinating because you find always new substances working through other mechanisms, and it's just amazing. And the last amazing thing is with this beehive air therapy. We are inviting a doctor from Romania who will present 17 cases of patients having problems in the lungs. And just by breathing the air from the hive, they have got improvements. Austrian Apitherapy Association, it's also very active. Swiss Apitherapy Association, they have 2 big sections, German and French, they are also very active. Italian Apitherapy Association was created recently. There is a doctor very active there too, and the Italians are very pragmatical and are doing a lot. Anybody speaking Romanian here? Nobody. Okay. So, but if you want to learn Romanian language, you can join the Romanian Apitherapy Association. Okay, International Federation of Apitherapy. This one is a very nice federation. It's like the same goals like Apimondia. Maybe you heard about Apimondia, the World Federation of Beekeepers. And it's our goal to create a similar kind of organization, but for apitherapists. And we have countries, associations from 11 countries. Okay, then Apimondia, as I told you, go to apimondia.org. Every 2 years there is an Apimondia Congress, and you know the very good news. In 2019 in Montreal, it will be a big Apimondia Congress here in Canada. Buying books on apitherapy. There are many books on apitherapy. You just Google and you find many of them. Not so many in English, unfortunately, but you find in English books like specific books, like book on pollen, some on propolis, but they are not very detailed. The very detailed ones are in other languages, but they will be also translated. How difficult or easy is to offer apitherapy? You may say that there are several forms of apitherapy: very soft and hard apitherapy. Very soft apitherapy is for everybody. It's like just use the beehive products as nutrition, as nutrients. And here everybody can give counseling on this area. Of course, the nutritionists, the dietitians, they know more specific things for treatments of severe disease like diabetes. But usually everybody can give advices on this area. Soft apitherapy is the use of beeswax, propolis, bee venom, but in creams, not in stings, like in hard apitherapy or bee venom injections. So for the first, if you would like to be specialized in apitherapy in the future, and if you do not have already a health practitioner base, you can opt for this first part or this one. But the hard apitherapy, it's more difficult, it's more dangerous because of the allergies and so on, anaphylactic shocks. So this is mainly for health practitioners. So it's a longer process, a couple of years to learn all these things. You must have first the needed knowledge and then the practical skills to practice any form of apitherapy. Here is the idea that your own beehives or our own beehives are at the same time a strong, a good api pharmacy. So it's good not to go to the pharmacy at the corner. Just go into your bee yard and get the bee products there, good quality, clean, rich in good substances. Preventing is always easier than treating, and my advice to you is to use the beehive products as much as possible daily with small pauses, small breaks, because this will prevent many diseases in the future. You can help other people if you go through these courses. Best apitherapy practitioners, and I saw this in many countries. The best apitherapy practitioners are also hobby beekeepers. Because if you don't know the bees, you don't understand them, you cannot cooperate with them, you cannot apply them very well. And the bees are teaching us so many things. When we understand how they protect themselves against viruses, bacteria, fungus, and so on, we can understand how we can treat also the human beings. Now, I have a few more slides at the end with the conclusions and take home ideas, but if we have some minutes free, I am open to any questions from you to discuss. Yes?
Stefan, we're told not to give honey to young infants. Why is that?
Okay, here is, first of all, it's a mistake. The team, scientists which studied many years ago honey and the risk of transmitting Clostridium botulinum, the scientists who were part of this commission themselves, they have not been sure that they advised to tell to the mothers not to give honey under 1 year of age is good. So this is the first thing. Second thing is that it's a mistake and it's not correct because Clostridium botulinum, it's an anaerobic bacteria. It's a bacteria which, when it multiplies into the guts, can be extremely dangerous. It's true because it creates a special toxin, which is neurotoxic. Okay, but this bacteria, you can find it very seldom in honey if the beekeeper was not working hygienically. Like some beekeepers, they work very fast. They take the frame, then they put it on the ground, on the grass. They look to some other things in the hive, then they get it back. And when they put the frame on the ground, on the dirt contains also possibly this bacteria. And then when it comes into the hive, then it contaminates the honey, and then you centrifugate and get in your final honey. Okay, but this Clostridium botulinum is present everywhere. In this room, if we'll do the microbiological analysis, we'll find billions of such bacteria. A child which goes 4 foot down, and the children, they put in the mouth all the objects because they are curious to see what it is. And even this bacteria can be found in the mouth of the mother or the father. So each time when the parents are kissing the baby, my sweet young child, transmits this bacteria. So it's not correct to ban only honey. They should ban all other things, all the objects, so which is, of course, not possible. But there is always a way. always when it's a problem, there are ways and to solve these problems. And the best best solution for you is, I found several years ago, is just to get your honey, and if you want to give it to a child which is 6 months old, because at 6 months old they already start to have this diversified nutrition. So you do microfiltration of honey. And if you do not want to lose the good vitamins from the pollen which is in honey, you do like this. You dilute the honey to 10%, maybe 20%, in boiled 2 times water to be sterile and cool down afterwards. So, and then you put the honey in cold water, but sterile water. Or you can even buy distilled water if it's more faster for you, it's easier. And then you can add to this solution also like 2-3 teaspoons of pollen, of fresh pollen. And you let it soak the pollen in this water for a couple of hours. And the vitamins and the good substance from pollen will come in the water. And then you have like a soup, honey pollen soup, if you want. And then you microfilter all this. And the microfilter, which is accepted in the hospitals, a very severe microfilter if you want, it's 0.22 micrometers. And you find this kind of filter everywhere in internet. Just Google microfilter 0.22 micrometers. And then after you microfiltrate this, then you get like a soup which is sterile, is no bacteria inside, absolutely no spore. Also for beekeepers, it's a $1 million idea when you want to feed your bees with your own honey from your beehives, from other beehives, not the beehive you are treating, because you know this problem with the nosema, spores and so on. But if you do the microfiltration, you have no worries. And then you can give to the child. And then step by step you can add some other bee products too. Yes. Other questions? Yes? In depression, you need to know the causes of depression. Like for every disease, you need to know the causes of the causes. If these causes are not very bad, not very deep, very genetical, you can use pollen, royal jelly, even propolis are antidepressants. And bee venom in small amounts for beekeepers is very easy. Bee venom stimulates the production of endorphin. So you can do it very well. And also you need to change the diet. And yeah, it's specifically, but it's very easy to do. Yes, other questions? Good. Then just one second to finish with the take home advices. 1 second. It's learn how to use individually the beehive products. Each person is unique and needs a unique treatment. You see here. So memorize these 3 things after my conference. If you forget everything, but keep in mind these three things. Second is, for a fast healing recovery, you need the use of all 10 beehive products, not only honey or bee venom or propolis or jelly, all beehive products you should use in the recoveries, in the treatments. And then the third principle is here to use simultaneously all these products and to administer them through all anatomical ways, like not through the oral administration, breathing, cutaneous, through the skin, locally. Like the idea is to use all anatomical ways simultaneously and all beehive products. And then you'll get the faster results. Thank you very, very much for your attention. Thank you.